How many toxins are there in our environments? Based on the large number of chemicals currently in production and the failure to test most of them for safety and toxicity, the likelihood is high that certain chemicals in wide use today are causing silent injury to humans in general, and specifically infants and children, and that their toxicity has not yet been discovered. The problem of children's exposure to untested chemicals can be imagined as a chemical iceberg. At the tip of this imaginary chemical iceberg are about a dozen chemicals now definitely linked to developmental disorders of the brain and other organs in children. These chemicals are known with certainty to cause lowered IQ, behavioral disorders, attention deficit/hyperactivity disorder, and autism spectrum disorders. Painstaking medical research has pieced together each of the complex puzzles linking these chemicals' role to developmental abnormalities in children. Yet, although exposures to these chemicals now form a clear and recognizable picture, generations of children have been, and continue to be, exposed to these chemicals, which include lead, mercury, PCBs, pesticides, polycyclic aromatic hydrocarbons, brominated flame retardants, bisphenol A, and phthalates. The next largest piece of the imaginary chemicals iceberg include approximately 200 industrial chemicals that are known to be neurotoxicants, which are chemicals capable of damaging the brain and nervous system. Studies in industrial settings have found these chemicals to be toxic to the brains of adult workers exposed occupationally. Each of these chemicals was identified as neurotoxic when it caused serious, clinically obvious, acute effects in workers exposed to it in the industrial workplace, yet the potential for these chemicals to injure infants and children has never been examined. The next lower layer of our imaginary chemicals iceberg shows that there are around 1,000 chemicals suspected or proven to be neurotoxic in animals. Again, although these are chemicals with a high likelihood of causing human health problems, they have never been examined in humans of any age. The largest portion of our imaginary chemicals iceberg shows the more than 80,000 new synthetic chemicals that have been produced during the past 50 years. Little is known about the toxicity of most of these chemicals. Yet humans, including pregnant mothers and fetuses in their wombs, are exposed to unknown numbers and quantities of them every day. In fact, the problem of chemical exposure continues to grow in every corner of the globe. New chemicals are introduced every month and global production of manufactured chemicals is increasing at a rate of over 3% per year. Today, with the globalization of trade, chemical manufacture is shifting increasingly to developing countries, where labor costs are low and often there are few or non-existent environmental and public health protections for the workers and the environment. Chemical pollution is increasing in developing nations, and hazardous wastes are accumulating. At the same time, pollution-related non-communicable diseases, such as asthma, heart disease, stroke, and cancer are becoming epidemic in countries where they were previously seldom seen. Furthermore, the once separate patterns of disease in developed and developing countries are converging. It seems that every human being is paying the price of flooding our environments with man-made toxins. Copyright Academy House www.academy.house